The NHS started on the 5th of July 1948, the brainchild of Labour Health Secretary Aneurin Bevan. It was designed to provide free healthcare for all. It was the first time anywhere in the world that completely free healthcare was available on the basis of citizenship rather than the payment of fees or insurance. The plan was to put all hospitals, doctors, nurses, pharmacists, opticians and dentists all under one organisation. It would be funded by UK taxes. At the end of the 1990s, healthcare was devolved to the Scottish and Welsh governments, but still funded centrally. Spending on the NHS has always been a political issue. By the early 1950s, to deal with the demand of a growing population, the government introduced charges for prescriptions, dental work and glasses. Aneurin Bevan resigned from the government in disgust. Today, the amount of money the government spends on the NHS is 12 times than when it first started. In 2020 to 21, spending in the NHS was £121 billion. That's about £3,840 per person. Nearly £17 billion was spent on drugs. When the NHS began, it employed 144,000 people. Since then, it's become the biggest single employer in the UK, with 1.7 million workers across England, Wales, Scotland and Northern Ireland. Alongside Walmart and Amazon, the NHS has one of the largest workforces in the world. Around 15% of NHS staff are not British. While it can vary region to region, on average, out of every 1,000 staff, 854 are British, 58 are Asian, 54 are from the EU, and 34 are from somewhere else. Advances in healthcare mean one big difference between the start of the NHS and today, and that's the number of beds available. Per 1,000 people, the UK has 2.4 beds, Germany has 7.9, and the average in Europe is 4.6. Critics say the number of beds is now a problem and it needs to be increased. Protect the NHS was one of the mantras of the COVID crisis. People turned out to clap on the doorstep to support the NHS workers as they battled against the pandemic. But the crisis revealed the cracks in the NHS. With an ageing population, a skills shortage, and rising costs, critics say the NHS can no longer meet the original vision of free healthcare for all.